This was pretty impactful for me, hence the reason why I'm making this video. It really is a sad reflection on ourselves within the musculoskeletal and spine rehabilitation industry, if this is what we're resorting to help our patients with spine-related pain or neck pain. It's kind of no different to me saying to my patients, here's a bottle of tablets, go home and take these, okay? Thanks for coming and seeing me. I know you've got back pain or neck pain. Just go take these tablets. They're really strong painkillers. Just take them, that'll sort out your pain, okay? Do you think that any of those patients would be satisfied if I just said to them, hey, I can write a prescription. I'm a doctor. I can write you a prescription for pain medications. Okay, that's it. What else do you want? They would never accept that as the only treatment option. But yet, the entire industry that we work in is doing exactly that. Okay, they can't write prescriptions because they don't have a medical degree. But in effect, fundamentally, what they are doing is no different to me just saying, hey, I can write a prescription, go and take these pain tablets. Because all of these things that we see the industry doing over and over again to patients is no different to me in my skill set writing a prescription for strong pain tablets, right? And you've got to realize that from a fundamental perspective, what I just described as something that I could do, which is universally unacceptable, but yet the rest of the industry is getting away with it, right? We are massaging, manipulating, manual therapy, dry needling, stretching, adjusting, applying electromagnetic pulse therapy. We're applying hot and cold therapy. We're applying transcutaneous stimulation on the skin. We're sending people for cortisone injections. Some people are doing these injections without even any radiological guidance. They're just injecting it into the region of the body that feels sore. Do a spinal fusion, which I've done many of. Okay, this is all symptom-based therapy. It's unacceptable as the only treatment modality that we offer. It is unacceptable. It is no different to me saying to my patients, here you go, here's a prescription for some strong painkillers, go and take them, that's it. Very few people are offering a treatment option that addresses the cause of the low back pain, the cause of the joint pain. Remember that we are dealing with a constellation of joints, discovertebral joints, facet joints, sacroiliac joints, cervical spine joints. We're dealing with joints. And the most important thing that determines the health of a joint is the stability of the joint, okay? The stability of the joint. If the joint is unstable, it is susceptible to injury. Stability is the ability to resist injury. So if we are going to offer something that is valid and logical and fundamentally optimal for our patients, we have to focus on advice that improves the stability of the joint. And what's the most important thing that determines joint stability? It is neural control and neural coordination of the muscles that are associated with that joint. Not how strong the muscles are, not how strong your core is. So therefore, core strengthening is of no value in terms of restoring neural control and coordination of joint movement. The next time we see a patient with severe back pain, plus or minus neuropathic lower limb pain or sciatic pain with a disc that looks like this, and invariably their MRI scan will show complete neural inactivity supplying the most important muscles that control the coordination and stability of that joint's movement. And here you can see it every time. There is evidence of severe lack of neural control of the deep stabilizers of the spinal joints. That's what they should look like, nice, dark and fleshy. And this is what almost every single person with back pain looks like, is this fatty infiltration of the muscles, which reflect the neural inactivation and poor neural control and coordination of the joint. It has nothing to do with core strength. Okay, this is 100% to do with neural control and activation of the muscles whilst engaging in your daily life activities. So core strengthening will not solve the problem, because core strengthening does make you stronger, but it doesn't enhance the neural control. So when you do core strengthening, you'll just make these other muscles stronger, which aren't involved in coordinating the stability of the joint. You'll still be unstable. You might have some stronger abdominal muscles or erector spinae muscles or pelvic floor or diaphragm, but you won't be any more stable, because those muscles are not involved in creating the joint stability for simple activities of daily living. Okay.